आपका स्वागत है। आदरणीय विष्णु प्रसाद शर्मा जी का स्वागत है, आदरणीय जगदीश्वर जी का स्वागत है और मेरे जयेश जी का, मेरी टीम में प्रीति और मौमिता का उधर से स्वागत है। आज सभी लोग, मैं आज इंदौर एयरपोर्ट से आप लोगों का स्वागत करता हूं। आज 362वां एपिसोड इंदौर से शुरू है। अब अग्निहोत्री जी का, शर्मा जी का, थंगवेलू सर का ऐसा आशीर्वाद मिलता है तो बस जहां से भी हो आप लोग संभाल लेते हैं इस यज्ञ को, तो मैं मतलब इतना आभारी हूं, मैं क्या कहूं, इसके लिए कोई मेरे पास शब्द नहीं। आप म्यूट हैं, आप म्यूट हैं।
आप बहुत धीरे चल पाए। कल रात आप इंदौर की होटल में थे और कल आप होटल से लेके आज खाली एयरपोर्ट तक पहुंच पाए पूरे दिन में।
नहीं, वो इमामी का भी नौकर हूं ना सर, इमामी का नौकर हूं, दिन में इमामी की बजाता हूँ, रात मेरी है, सुबह मेरी है।
वही तो मैंने शेयर किया। धन्यवाद,
स्वागतम। तो मैं रिक्वेस्ट करता हूं आदरणीय विष्णु प्रसाद शर्मा जी, एक्स प्रिंसिपल गवर्नमेंट आयुर्वेदिक कॉलेज गुवाहाटी एंड प्रेसिडेंट विश्व आयुर्वेद परिषद आसाम, वेलकम सर। और I would like to request you for your address, and then Mr. Dr. Jayesh Thakkar will moderate today's session along with Madan Thangvelu sir, and for valedictory remarks as exclusive Dr. V.K. Agnihotri sir, Professor and HOD, ex-Professor and HOD, Uttarakhand Ayurveda University. Welcome, welcome to all. So now I would like to request respected Dr. Vishnu Prasad Sharma ji for his welcome address. Welcome, sir. Am I audible to you, sir? आदरणीय विष्णु प्रसाद शर्मा जी।
सर, नेटवर्क प्रॉब्लम था। Can you hear my voice?
Yes.
So good evening. Namaskar to all. Respected Professor V.K. Agnihotri ji, respected Dr. Madan Thangvelu ji, respected Dr. Bhavan ji, eminent speaker, guests, ladies and gentlemen. Good evening.
Sir, your connection is unstable, I hope. That's why we are unable to hear you. Respected, yes.
So, wonderful regarding VISHAM subject.
No clarity.
Yes, due to internet instability. मैं सर से रिक्वेस्ट करूंगा बीच में, जब सर का इंटरनेट कनेक्शन स्ट्रांग होगा तब सर से हम रिक्वेस्ट करेंगे। तो
हाँ, तो डॉक्टर आरथी PS, डॉक्टर स्वागत, welcome all of you to this webinar, including eminent speaker, yes, ladies and gentlemen. And I declare that today's webinar is open. Thank you. Namaskar to all.
Thank you, sir. Thank you very much. We would like to. जी सर, जी सर, बहुत बहुत धन्यवाद। जी सर, बहुत बहुत धन्यवाद, बहुत बहुत धन्यवाद आपका। We would like to welcome you all on behalf of Independent Research Ethics Society. Today's subject is very unique, VISHAM, which can include corona also. Corona, malaria, typhoid, whatever these intermittent, unstable, these all types of fever which cannot be diagnosed by modern technology also doctors are also confused why this fever is continued. So on these topics, I would like to welcome all the speakers today, first of all, and then I would like to request Dr. Jayesh Thakkar to introduce our first speaker of the day and start the webinar. Dr. Jayesh Thakkar, please.
Yes. Thank you, sir. Thank you. Namaste and welcome one and all to today's special event. As we know, Independent Research Ethics Society celebrates every day with Ayurveda. Today is World Malaria Day. 25th of April is celebrated in recognition of controlling the dreadful disease malaria. As we know, malaria is spreaded by mosquitoes, but if we see the count, lakhs of people have died in Asia, Africa, and lots of continents of malaria. And today, celebrating with Ayurveda, today we are celebrating 362 of webinar of ours. And every day we celebrate with Ayurveda. So today the topic is VISHAM JWARA. We will like to discuss VISHAM JWARA, the care and cure with Ayurveda. Today we are lucky to have 4 speakers from different parts of India with us. Our program is live in YouTube channel of Independent Research Ethics Society. So without taking more time, let me take the pleasure to introduce and welcome our first speaker, Dr. K. Krishna Kumar, sir.
Thank you.
Sir, can you listen to us?
Yes, yes.
Yeah. So our first speaker of the day is Dr. K. Krishna Kumar, sir. Sir is a well-known name in the field of Kumar Bhritya. Sir is professor and head of the department of Kumar Bhritya in Mansoor Ayurved Medical College. So let's take the pleasure to welcome sir. Sir, the dash is yours.
Thank you.
Welcome,
Thank you.
Dr. Kumar. Welcome. Thank you. Thank you for joining us today.
Yes, yes. Thank you, sir. Thank you very much. So, is it visible, sir?
Yeah, sir, full screen.
Yeah, sure. Is it visible?
Yeah, now it's perfect, sir. Sir, you can begin. Thank you, sir.
Thank you very much. And once again, I'm the first speaker, so I'm happy to have you all in my lecture. And once again, I'm very much thankful to our coordinator Sharma sir for the valuable opportunity. I know that a lot of scholars are here, and you are well versed with the subject. So today is Malaria Day. So malaria is almost similar to VISHAM JWARA. So I'm starting the seminar without wasting much time. So I have been told that I have to finish this session within 10 to 20 minutes. So I'm starting it. So initially about the disease in a nutshell. So I'll be focusing on the VISHAM JWARA aspect. My learned scholars are there to narrate about the malaria aspect. So I'm not focusing upon that. I'll be giving an introduction about the disease. I know that everybody is scholars, and once again, if it is worthwhile, then I'll be grateful. Thank you very much, sir. So about the VISHAM JWARA, actually, the VISHAM JWARA is Jwara with almost irregular pattern is called as VISHAM JWARA. Normally, mostly it get complicated while treating. So it is termed as Krichrasadhya or Asadhya stage, and it is prone for Dhatu-gata avastha or Dhatu Vilina avastha of Ama, and Ama is the key factor there. And whereas Ama is otherwise called as Visha also. So we have to treat the disease with great care. And here Vata and Kapha is having a greater role here. But because of the time delay from the start of the Jwara avastha, Pitta is every time we have to keep an eye on Pitta. which can cause the destruction of the dhatus. So it is having a closer resemblance with malaria. The pattern of fever is causing similarity that is there. As we all know that ज्वरा is of तीन दोषों से ही होते हैं, ऐसा करके हम सबको पता है. इसलिए तारतम्य भेद के बारे में हमें थोड़ा सा जानकारी लिया तो हमें ये डिसीज को कंट्रोल करने के लिए थोड़ा सा इजी होगा. And we have to keep an eye on the symptoms of Vatika Jwara, Paitika Jwara, Kafaja Jwara, and Sannipatika Avastha also. Even though the 5 types of Jwara and Anya Jwara is mentioned, we have to go as Vishesha Avastha only. And Buddha Abhishanga Janita Agantuka Vikara, it is also considered as Buddha Abhishanga Janya Agantuka Vikara as well by our Acharyas. And it can also be caused by the negligence, not only with the, it is in modern aspect, it can be correlated with the malaria, but the Santata Jwara, etc., and it is having close resemblance with the common cold as well. So once again, in Ayurveda, Mithyahara, Vihara, and production of ama production कुछ भी ऐसा करके ऐसा वाला the आहार विहार किया तो नेग्लिजेंस किया, अगर रोगी ने नेग्लिजेंस किया तो ये व्याधि वापस आने की चांसेस है, इसलिए विषम ज्वरा है. तो इसके अंदर हमें ताजुब लगेगा कि क्या विषम क्या है. ऐसा करके विषम is otherwise it can be called it as बी समा, वो समावस्था के विपरीत जाते हैं ऐसा करके. नॉर्मली जो मिलते हैं, नॉर्मली हमें जो एग्जाम्पल मिलते हैं उसकी ऑपोजिट जाते हैं ऐसा करके हमें विषम ज्वरा ऐसा हम उनको नेम कर सकते हैं. एंड we can name it as well. And Acharya has clearly told that Vishama Arambha, Vishama Kriya, and Vishama Kriya Kala, the Kala, these 3 things are actually taking part inside this. So where it is starting and when it is starting, that uncertainty will be there. So it can be called as Vishama Jwara. And the Kriya and how the pattern of fever, how it is there, and the Tikshnata of Jwara, how it is there, that also a little bit complicated by for Anumana aspect. So that also can be considered as Vishama. And in Kala, as Kriya Kala and the days pattern as also it is having confusions. So it is in normally it is not in Rasadhatu. So it is hiding inside the other dhatus. That so it can come at any time. So it can be called as the Vishama. And a little bit about Jwara. Jwara is त्रिदोष जनिता पैतिक व्याधि ऐसा करके ही हम जाना जाते हैं. हम लोगों को तो पता है कि त्रिदोष जब प्रकोप होते हैं उस समय वो आमाशय में चला जाते हैं. जो फूड मटेरियल्स हम जो खाते हैं that will not be getting digested, and the Jadragni will be going towards the periphery in the dhatus. ऐसा करके हमें the slokas batate hain. As learned scholars of Ayurveda only sitting here, and I don't want to narrate the samprapti aspect in a detail, because all of us knows. And here particularly the ama is circulating from the amashaya towards the rasayanis, that means blood vessels. So here the modern concept also we have to understand there. So here the homeostasis of acid-base balance will be getting distracted, and we know that Pachakagni is having Tektadravatvam Pagadikarmana Anala Shabditam. That is the main thing, focusing there. So if acid and alkali के अंदर ज़्यादा पानी हुआ तो dilution rate का problem हो सकते हैं, and when the gastric juice and the pancreatic juice is getting absorbed into the veins, inferior mesenteric vein and superior mesenteric vein, हमारे शरीर के अंदर पोर्टल वेन पे जब उसको वो जो गैस्ट्रिक जूस को अब्सॉर्ब करते हैं, अगर डाइल्यूशन रेट पे कम ज्यादा वाला एसिड एंड अल्कली द अनरस के साथ अगर बॉडी के अंदर चला गया, whenever the patient is getting आम ज्वर में normally what will happen is patient will be getting frequent urination and sweat नहीं है, इसकी वजह से बहुमूत्रता रहते हैं. So normally बहुमूत्रता के कारण शरीर के अंदर से ज्यादा पानी बाहर निकल जाते हैं, and because of the ama also the drava, the watery content will be there more inside the blood vessels. When the patient urinates, at the time the agni will be getting acid and alkali reactions will be happening inside the blood vessels, that is in the periphery. So the heat is transmitting towards the outer part of the body, and slowly the internal organs will be losing the heat. So that is what is happening here, and the patient is also not getting proper nutrition. That also should be considered while we are dealing with the jwara. So as we all know that according to Ayurvedic concept, there are three avasthas of jwara, that is sama, pachimana and pakwa avastha. There are lot other things are also there, nava jwara, purana jwara, madhyama jwara and all will be there. But for the treatment aspect, as I know that the practitioners are sitting here, 12 practitioners are sitting here. So once again, I just want to clarify, for the treatment aspect, sama avastha, pachimana avastha and pakwa avastha should be highlighted here. So that is one thing, and we have to have a concentration upon that. And Srodhoroda and affliction of Jadaragni and Dhatvagni is the main factor for jwara. And Purva Rupa, in Purva Rupa Avastha, Dosha Sanjaya will be happening. That is the first Kriya Kala, the Dosha Sanjaya and Sthana Samshraya aspect will be happening. So first or third, the Kriya Kala will be there. So in case of malarial aspect and all, incubation period can be considered as Pururupa Avastha. And in the first phase, production of kapha in Prabhuda Matra will be happening during jwara. And because of the blockage of the kapha, Vata will be getting provoked. And in the second phase, Alpa Kapha Avastha and the Sama Pitta Pradhana Avastha will be there, where initial Tiktarasa Sevana is mentioned in the first phase, and in the second phase, Alpa Kapha, the Sama Pitta Pradhana Avastha, that area we have to give the Kashaya Rasa, and later on in the third phase, Kevala Pitta Avastha में हमें उधर घृतपान सभी देना चाहिए, ऐसा आचार्य ने बताया है, एंड हमें उसकी मीनिंग ऐसा ही मिलते हैं. एंड जब पित्ता इज गेटिंग मोर अग्रेसिव, देन व्हाट विल हैपन इज धातु पाका विल बी हैपनिंग. बिकॉज ऑफ दैट धातु क्षीणा अवस्था विल बी हैपनिंग. सो one more very important factor is patient is starving because of not having nutrition, because of the indigestion aspect. As well, the pitta is getting higher in the peripheries, So dhatu paka is also happening. Each and every cells will be suffering with that. And we know that because of the taratama beda of beda aspect and the causative factor aspect, 8 types of jwaras are there. I am not going to explain all those things, but still I'll be telling that while considering those types, we have to consider innumerable variations also because of the taratama bheda aspect. And while going through the samhitas, we can understand that Acharya has mentioned samanya chikitsa like jwarado langanam proktam jwara madhye dupachanam jwarante rechanam shastam edat jwara chikitsitam ऐसा करके बताया है. एंड विशेष चिकित्सा वात प्रधान ज्वर में क्या करना है, पित्त प्रधान ज्वर में क्या करना है, ये सभी बताया हुआ है. एंड देन लाक्षणिक चिकित्सा, one particular symptom is highlighting there in the in while treating the disease, something is coming up, that particular lakshana को treat करना चाहिए, ऐसा करके आचार्य ने बताया है. So this is very important. And here another one thing I just want to highlight, while we are dealing with the Vishama Jwara, Vyadikshamatva, Ojas and Vikara Vikadagara Bhava, which is mentioned in a similar context of Prameha by the Charakacharya. Charakacharya has told that there are 3 things which are responsible for the Vikara. विकार विखादगर भाव अभाव, बोले तो व्याधिक्षमत होने का या न होने का 2